Hi, I'm Dr. Raj Bethapudi, GP at Galleries Medical Practice, Clinical Lead for Cancer at Sunderland CCG, and local Macmillan GP. Over the course of this presentation, I'm going to talk about what you can expect from your GP surgery from the point of diagnosis of cancer. I would like to start off by saying that you are not alone. We at the GP surgery, along with our Macmillan team, district nurses, palliative care teams, and of course the hospital staff are here, right here to support you and help you through this journey. Let's take a step back and see what happens from the point of diagnosis of cancer. Within 24 hours of diagnosis, the GPs receive a cancer notification diagnosis. At this point, we tend not to contact the patient. Of course, having said that, if you have any issues that you want to talk to your GP at this stage, feel free to give us a ring. The first 3 or 4 months is usually a number of trips to the hospital, going through the treatment, and after that, once the major part of the treatment is completed, and after a needs assessment is taken place at the hospital, we get a treatment summary. The treatment summary details the stage of diagnosis, the treatment that has been undertaken, a key contact, and the next steps. You should receive a copy of the same. Following this, within the first 6 months of cancer diagnosis, the GP surgery sends out an invite for what we call as a cancer care review. It's very important that this review takes place, and it gives an opportunity for us to understand what your experience has been like. And you can ask any questions, not only pertaining to cancer, but anything about your physical health, mental health, emotional health, or anything that you are concerned about. What would be helpful is if you can make a list of what you want to talk about, so it gives you enough time to discuss all the key issues. People's needs are different, so no two persons' needs need to be the same. So never think, is this the right thing to ask my GP? Does my GP deal with this? Please feel free to ask. We may not necessarily have all the answers for your questions then and there, but we certainly would be able to signpost you in the right direction, be it a referral to occupational therapist, or be it a referral to a social prescriber, or even simply asking you to contact the cancer nurse specialist if that is the most appropriate thing to do. So what happens during a cancer care review? This is usually undertaken either by a practice nurse or a general practitioner or a trained senior clinical member of the team. We go into the details such as medication side effects, mood, anxiety issues, social issues. Sometimes it could be something as simple as, look, I'm not able to use my shower upstairs. It could be something as simple as that, or it could be having symptoms such as dry mouth, anxiety, depression, fear of cancer recurrence, inability to cope at home, or if you're a carer for someone, being unable to take those roles anymore. So it could be anything and everything. And as I've said, we may not have necessarily the answers, but we are here to signpost you and help you in the right direction. What questions do we normally get asked? Personally, the biggest worry at the back of people's mind is the cancer going to come back? So for that, I would always say, your cancer nurse specialist and your GPs can give you a set of symptoms that you need to look out for, what we call as red flag symptoms. And if you notice any of these symptoms, please don't sit on it. It could be any time during the journey of cancer. Give the receptionist a ring, explain to them that you're worried about cancer recurrence, and we will be able to prioritize that call. Sometimes these symptoms may be completely different to what you were told to expect. That is absolutely fine, because sometimes the symptoms can be very vague. It doesn't matter. If you're concerned, please pick up that call. And it doesn't have to be in the first 6 months itself. It can be any point during the cancer journey. One of the common things I get asked is, I'm not sleeping very well, I feel exhausted, I feel tired, I feel anxious, I feel depressed. That's okay. While some of it is quite natural to feel like that, certainly we do have help at hand that can address those very issues. And as I've said before, if we are not able to deal with it, we certainly would be able to point you in the right direction. Moving on, sometimes people ask about, look, I don't want any more treatment for cancer. These are the advanced stages of cancer. That is absolutely fine if a decision is made between the hospital team, the GP, and of course yourself that you don't want any further active treatment for cancer. That is fine. We'd like to respect your decision, and those very conversations can happen with your GP as well. If you prefer to avoid hospital admissions and arrange all planned care at home, we do have the right links in the community to deal with it, and we have what's called as an emergency healthcare plan, which details what you wish to have during the advanced stages of your cancer. It is important that you attend the chronic disease reviews. Just because you have cancer does not mean that you ignore other chronic conditions such as asthma, heart disease, etc. If you have any of those conditions, please keep up your yearly chronic disease reviews, or if you have any problems with those conditions as well, feel free to ring us at any point in time. In summary, we as your general practitioners are happy to support you right through the diagnosis, treatment, recovery, and beyond. Thank you.